On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way. Welcome to Health Her Way. I'm Brooklyn Elbert.
And I'm Meredith Cunningham, and today we are joined by cardiologist Dr. Haley Hughston. Thanks for being here with us today.
Thanks for having me.
Absolutely. Dr. Hughston is board certified in a lot of things, but the one person that pertains to today is cardiovascular disease. She's passionate about women's heart health and dedicated to advancing care and awareness in this area. So thank you for joining us today so we can really dive into these topics and ask you these questions. And I am not going to lie. I am that patient that when you guys say, hey, your blood pressure is 112/70, and I go, okay. And I don't actually know what on earth you guys mean by that. So when I say today that we have no background in heart health, we have no background in heart health.
That's okay. We'll take it from there.
Thank you. So I think one of the biggest questions before we kind of dive into the specifics is, why should those of us in our 20s, 30s, 40s care about our heart health?
Well, almost 50% of women will start having heart conditions by age 20. So it starts young. And if we take steps when we're in our 20s and in our 30s, we can hopefully prevent the bad heart attacks, the strokes, the heart failure that can really, not only cause death, but also just make you have a poor quality of life. And so the earlier we start being aware of what's going on with our health and taking steps to prevent the bad things from happening, then we can avoid a lot of those outcomes.
Okay.
So what is heart disease and what are the different types of heart disease?
So this is that's a really good question, because I have patients that will come to me and they haven't had anything happen to them. They haven't had a heart attack or anything like that, but maybe they have a family history of quote unquote heart disease. And that is a big, big topic. And so it's very important to know, that what the different kinds are, so you can be more specific when you're talking to like your primary care or your cardiologist about what kind of heart disease either you have or it runs in your family. So the most common one that we think of course, is coronary artery disease. That's when we think of people who are coming in with heart attacks and need stents and bypass and all that. But there are other ones like heart failure, and that's when you have a problem with the pumping function of the heart. Sometimes the heart doesn't squeeze well. Okay. So the pump is not working properly, but a lot of times the squeezing function of the heart is just fine. It just doesn't relax well. The heart muscle is stiff, and that can still lead to things like volume overload or too much, you get swollen in your legs, have problems breathing, that sort of thing. There are others like arrhythmias, and there's many different kinds of arrhythmias. Atrial fibrillation is one of the more common ones that we deal with. Sometimes people will be like, oh yeah, my grandmother has that or something. You can have problems with your valves, and some of that can be congenital. It can be like an issue that you were born with, where either the valve doesn't open all the way or doesn't close all the way. And sometimes it's just something we watch, and sometimes you have to have surgery to repair it. You can also have cardiomyopathies, which are more like your genetic, mostly more your genetic issues, like hypertrophic cardiomyopathy is one that you hear about in the news. That's one that tends to kind of pop up in like the young athletes who like tragically pass away on the football field or something like that. You can have aneurysms within some vessels, like your aorta. You can also have aneurysms, of course, in the vessels in your brain. So those are kind of the big kind of topics within when people say heart disease that, we kind of think about. So just knowing specifically what kind of issue you're talking about is very important and helps me kind of better treat you.
Yeah. So of those conditions, are there ones that are more prevalent in women?
As compared to men, or, they're all prevalent in women. So, coronary artery disease is one that, so I guess let me back up and say that heart disease as a whole, or coronary artery disease, is the number one killer in men and women. Okay. So the issue with heart disease when it pertains to women's health is that it's more that it doesn't get diagnosed in a timely fashion. And so it often goes untreated. And so women have worse outcomes, if that makes sense.
Yeah.
Okay.
So why is it not diagnosed enough? Like, is it because women just aren't going to the doctor, or is it because the symptoms may be different than men, or so what is it?
I think it's I think it's many different things. And when we're talking specifically about, coronary artery disease specifically, the symptoms that women have when they're coming in. And so coronary artery disease is narrowing of the vessels that feed the heart muscle. Okay, so that's when we think about heart attacks and stents and bypass. Okay, so the symptoms that women have are different than men. So a lot of times the question will be, are you having chest pain? But most women for certain, and most men don't say it's not, they say it's not painful. It's more like it's pressure, it's heaviness, it's tightness in my chest. And women also will complain of other symptoms as not just the tightness and the heaviness, but they'll say, I'm short of breath. I feel like my heart's racing. Sometimes they describe it more as like indigestion kind of, or like a burning sensation. You can have like sweating. So they are complaining of more than one symptom. And that may trip up whoever is first kind of talking to them. If it's, somebody in the ER, a primary care, or even a cardiologist, because they're going down different pathways. And so, and I think that there's kind of this conception, or maybe it's not recognized by women, that heart disease is still our number one killer, as opposed to, people think, oh, it's breast cancer or whatever. No, it still is your heart. And so there's some idea that, oh, it can't be me. I'm a woman. I'm in my 50s. I can't have heart disease, that sort of thing.
So because you just mentioned it and not understanding the symptoms correctly, for those of us who have never really had a panic attack and then do have a panic attack, it kind of feels like maybe a heart attack or something, like I can't breathe, like I'm just stressing out or whatever. So I guess at what point, though, obviously I'm fine, I survived. But at what point do we take a look at some of these symptoms and go, I might need to call somebody, or I might need to go to the doctor? Like, at what point is it like, because then they can tell me this is a heart attack, or no, you just need to brown paper bag it a little bit.
Well, that's a good question. And sometimes it's a hard question to answer. I think if you've ever had, if you've had a panic attack for your first time and you don't know what it is, you should get evaluated, because maybe it is a panic attack and you need to be on anxiety medications and all that to kind of help prevent that. But it could very well be an arrhythmia. And I see a lot of women who are, just told oh, you're just anxious, whatever. And they're like, oh, I'm not anxious about anything. And I'm not saying that you have to be anxious about something to have a panic attack, but sometimes it's out of the blue all of a sudden and I don't know what caused it. And lo and behold, we do a workup and we find that maybe they have an arrhythmia that we never knew about. So I think that, and this goes for, really anything for women. If it's something that's happening that's not normal, that has never been evaluated before, you should go see, in the beginning, it's probably your primary care doctor and telling about these symptoms. And if they tend to brush you off, then maybe you go see somebody else, okay? And try to get your questions answered with at least some, diagnostic testing before we just say, no, it's just anxiety.
Anxiety can lead to probably some stress, or maybe stress is the cause of the anxiety. I don't know, maybe it's which came first, the chicken or the egg or whatever. But I've heard that stress is not good for your heart.
It's not good for a lot of things. I mean, stress, chronic stress, can raise your blood pressure. There's some inflammatory issues that can happen with it. You can have all sorts of digestive issues. So it's never, it's good. It's not good for a lot of different things across, your health. It's hard to treat a lot of the times, and I don't, treat, anxiety and all that sort of thing. But it can be hard because you have to look at different factors of, why are you having chronic stress? And of course, there's situational, which are much harder to take care of. And some things, there are really good, anxiety medications out there too that can help.
Have you guys seen that trend on the internet where it says something like, I was stressed out about something and my husband told me to relax and it fixed it. It's all better now.
Yes. Don't worry about it.
Don't worry about it. It's like, oh, I'm all better.
Yeah. Thank you for that.
Yeah. Speaking of risk factors, what are some other ones of heart disease that we need to be aware of?
So there's the classic ones that we think of course, high blood pressure, high cholesterol, diabetes is a big one. Other things like smoking, tobacco abuse is horrible for vascular disease. I mean, not just heart attacks, but strokes, problems with blood flow to the legs. being overweight or obese, sedentary lifestyle. Those are kind of, the more traditional risk factors that we think of that affect both men and women. And then there are some risk factors that are specific to women, such as pregnancy complications. So, and that's why we say that heart disease kind of can begin really in your 20s or 30s. That's when a lot of women are getting pregnant. And so if you have complications during your pregnancy, such as like gestational hypertension, which is high blood pressure during pregnancy, gestational diabetes, preeclampsia, early birth, okay, so like before 37 weeks, and then there are a few others, that is a predictor of you could have cardiovascular disease later in life, because pregnancy is kind of the natural stress test on your system. Okay. And so actually, the American College of Obstetrics, which is, your OB-GYNs, they recommend that if you have had any of these pregnancy related risk factors, you actually be screened for cardiovascular disease within 3 months of delivery. And that's something where I don't think that a lot of women maybe know that. I know that they should be screened. So that's something I'm hoping that this podcast raises awareness for.
Yeah.
But that's a woman specific risk factor. Others would be like autoimmune diseases. So like lupus, rheumatoid arthritis, psoriatic arthritis, those sorts of things. And that's really because that those autoimmune diseases tend to be more common in women compared to men. Others would be like polycystic ovarian syndrome, and also actually depression and anxiety is more common in women compared to men, and that raises your risk for cardiovascular diseases.
So you just mentioned pregnancy, and I think a lot of us think that if you have these issues like gestational diabetes and they resolve themselves, then you're fine and you can go back to normal. But I think from what I'm taking away from your discussion just now is that you may go back to normal, but you may need to just do some double checks in the future.
You do. So, you should be screened for diabetes, at least annually. And that's because if you have gestational diabetes and pregnant, your risk of developing full-blown diabetes is much, much higher down the road. It's kind of almost like a predictor of the future. Okay. So you can't just be like, oh, I'm never going to need to get checked for 10 years. No, you should still be seeing, your primary doctor, annually to make sure that you're getting, at least once a year an A1C or a blood sugar check or whatever to make sure that you're not trending that way.
And so it's the same thing for gestational hypertension.
Yeah, same thing. You're just it's kind of predicting the future. And so just making sure that you're still getting screened. And there are some things, like lifestyle things that you can do to try to help minimize the risk, but yeah, you still need to be getting screened and getting followed for that.
So what are the lifestyle things that we can do in general? Obviously, you just talked about some of them, no smoking and get your exercise. But whether you have these problems during pregnancy or you're just trying to live a healthy lifestyle and protect your heart, what can we be doing to help ourselves?
The biggest thing is maintaining a healthy weight. Okay. And that's something, obesity is kind of is a pandemic in this country. And a lot of these things that we, like high blood pressure, high cholesterol and diabetes, when people lose weight, they go away or they get much, much better. And a lot of times, especially for things like high blood pressure, I'm taking medicines off or I'm reducing the doses. They don't need as much. Now that's not everybody. There's definitely people who just genetically have high cholesterol and there's, nothing that they can really do from a diet or exercise to significantly change that. And that's fine. If that's you, that's fine. That's why we have excellent medications out there to treat that. But the biggest thing to help prevent those three things is maintaining a healthy weight. And that boils down to diet and exercise.
You've said it a couple of times, and we prefaced the start of this episode with, we don't know what that means. So help us understand.
Just have to ask that.
What we know high blood pressure is bad. We know high cholesterol is bad. But what is high blood pressure and what is high cholesterol? What is it doing to your body? How is it not functioning the way it should? That's
a really good point. So high blood pressure would be, so the goal blood pressure is less than 130 over 80. Okay. So, running, you want your blood pressure to be kind of in the 120s, and that's the systolic number, I should say. So that's the top number. Okay. And then when you check your blood pressure, the bottom number is a diastolic, and you want that to be less than 80. Okay. So if it's like, let's say you check your blood pressure and it's 130 130 over 82. That's considered elevated. That's not a normal blood pressure. And then, of course, if it's, in the 140s or higher, then it's definitely high blood pressure. And why is it bad for your body? It's hard on your heart, especially if you have really high blood pressures, because the heart's a muscle. And if it has to pump harder against high blood pressure, it thickens up and it gets stiff and it can lead to heart failure and all these other things. And it's hard on the vessels. It can cause, strokes. It can cause kidney failure, small vessel disease as well. So a big part of knowing or of being proactive in your health is things like knowing your numbers. Okay. So knowing what your blood pressure is, and you don't know what your blood pressure is if it's not ever being checked. Okay. Because high blood pressure is the silent killer, because we can't tell. I can't tell if my blood pressure is 150 over 90. I'm not going to feel that, but my kidneys are going to feel it. And in 10 years, I may have kidney damage and I would never have known that. Okay. And then when it comes to cholesterol, this is a good point. So people come to me a lot and they're like, yeah, my total. So when you get your cholesterol checked, it's going to spit you out 4 numbers in a traditional cholesterol panel. And a lot of people just pay attention to the total cholesterol. And I pay like almost zero attention to it. Okay. Because people kind of like, oh, my total cholesterol was like, I don't know, 190 or something, which less than 200 is considered normal. But that doesn't tell me what's going on underneath, okay? So the total cholesterol is made up of your LDL, that's your bad cholesterol that leads to strokes and heart attacks. Your HDL, which is your good cholesterol, that protects you from those things. And then your triglycerides, which is that's a bad cholesterol too, okay? And so your HDL for women, we really like it to be greater than 50, ideally greater than 60. And then for the triglycerides, we like those to be less than 150. So sometimes people's total cholesterol can be good or maybe just a little high, but their LDL, their bad cholesterol is significantly high. Like maybe it's like in the 130s or so. And so their bad cholesterol is high. And then their HDL, which is their good cholesterol, is low. And then together you put the total cholesterol and it doesn't look that bad. So it's important to you can't just write one number down or just have one piece of the puzzle. You got to have the whole thing. And so, again, you're not going to know if your cholesterol's bad unless you get it checked.
I feel so validated when I ask our experts and they go, that's a good question. I'm like, yes. Also, I'm going to go home and tell my husband, I learned something today. How do you even check your cholesterol?
It's a blood check. Okay. Yeah. And usually it's done on annual labs that you would go and you'd see your primary care provider and they would check it once a year. And then if it's high, sometimes they'll check it more often than that.
How often should you be having your blood pressure checked?
That is a good question. So if it's normal, it kind of depends. If I am a young, healthy female and I have never had blood pressure issues, then I may have it checked, once or twice a year in my primary care. But if I have like a weird reading, go get yourself a blood pressure machine. I mean, I think they're like $30, maybe $50. You can get them in any pharmacy. You can order one from Amazon. And then I would check it at home and I would keep a log. Okay. And I do this to my patients all the time. You should check your blood pressure. You don't want to check it right when you first wake up. You want to wait about 30 minutes. Okay. And then, you're supposed to be like kind of sitting calmly in a room, your feet aren't supposed to be crossed. So you want to do it at a time when like you're feeling like your most normal self. Like I describe it as like I'm sitting on my couch drinking my coffee, like I am calm. And I would check your blood pressure, write it down. And then and then you also want to check it sometime when you're first trying to get like an idea about how you're running, and maybe in the evening or the afternoon. Again, don't do it when you're first getting home from work and the kids going nuts. Like wait until it's a little bit more calm and then check it. And then do that for a week and kind of see where you're at. But if I was, maybe I'm still a young, healthy woman, but I know that my mom has high blood pressure and maybe I have a family history of it, then I might be a little bit more proactive and I might be checking it more often. And if you're on blood pressure medications, you really should check it at least once a week, just to make sure that everything's kind of running like it should. And then if you start getting abnormal numbers, then you're going to want to keep a log to kind of see where you're at.
Okay.
So we've talked about heart attacks. We've talked about stroke. I think I've always thought stroke is brain. heart attacks are heart, but I'm learning they're more closely connected. And so can you explain to us the difference between the two and how some of these things like high blood pressure, high cholesterol, whatever, are causing heart attacks and strokes?
Well, because they cause plaque buildup.
Okay.
So high cholesterol and high cholesterol causes cholesterol or plaque. We call it plaque buildup within the vessels. And high blood pressure just injures vessels. And when an injured vessel is more like it's diseased and it's more likely to, have problems with plaque or stenosis or narrowing. If your blood pressure is super high, of course, then you can have a stroke just from that. And so, we look at the total, cardiovascular risk. And one way that you can get like a risk stratification that helps predict heart attack and stroke is something called a calcium score. Have you ever heard of this?
No.
Okay. So a calcium, I've heard
of The only reason why I heard about it is because she said it before.
Yeah, probably.
I've heard you say that's why I
but
said
I have no idea what it is.
Okay.
So a calcium score is it's a CAT scan of your chest, okay? And what we're looking at is calcium within the vessels of the heart. Okay, so if you have plaque or cholesterol buildup in the vessels, the vessels try to heal themselves for lack of better terminology. And so they take that plaque or that cholesterol, which if you can imagine, it's like fat, so it's soft, okay? And they calcify it. They make it hard almost like bone, okay? And so if your calcium score is 0, it suggests that you have none or very minimal, vascular disease. But if your calcium score is high, and high kind of depends on, what your age is and everything like that, then you have some, okay? And so, one thing that's very helpful for some of my patients who are maybe a little younger, or maybe they have high cholesterol, and we're like, should we bite the bullet? Do we put you on cholesterol medications? Or maybe they have like just a raging family history of coronary artery disease, like heart attacks and things. So you get a calcium score. And if your calcium score is high, then we start becoming more aggressive with cholesterol medications. Sometimes we start even recommending like aspirin, like 81 milligrams of aspirin. And so it just kind of helps give a little bit more information to know which bucket to put you in, like how aggressive to be with your medications.
If you have a heart attack, a stroke, something like that, you just mentioned medications. I'm sure there's some kind of surgical procedures too, where you guys help go clean out the plaque, open the vessels, whatever. Is this like a lifelong thing, or can you recover and not have to be on medicine anymore?
No, if you have a heart attack or a stroke, you're on medicine for life.
Okay.
I mean, really, like once you be a cardiologist, you pretty much start. There's of course there are people that I dismiss from clinic, but most of the time you kind of are seeing me maybe once a year, but for life, because it's not a diagnosis that goes away. And once you've had one event, you're more likely to have a second. And the vessel tree is all linked. So what's going on here is going on in your brain, it's going on in your legs. I mean, peripheral artery disease is a huge issue as well. And so, we see you for life.
No offense, but I don't want to become your bestie anytime soon. I don't want to have to come see you. So listen to her tips so we don't have to go see her forever. I feel like there's so many more questions, like things that you just mentioned, like peripheral artery. Did I say that right?
Peripheral artery disease.
Thank you.
I couldn't even say it.
That makes me feel better.
Raise myself up on it.
Because I feel like everyone always thinks like your heart is connected to everything, and so it really does impact everything. So let me ask you about that real quick. If I do have, like, does one condition very much easily lead to another one?
You can.
Like, are you more likely you're not just gonna have diabetes, you're probably gonna have this and this and this or something.
I mean, so there's something called metabolic syndrome. It's a medical term, and what it means is you have high blood pressure, high cholesterol, diabetes, and you're obese. And that's a lot of people in our nation. And metabolic syndrome that exceedingly raises your risk for coronary artery disease, peripheral artery disease, all sorts of, strokes, all sorts of vascular kind of complications. And then, coronary artery disease can lead to heart failure, and coronary artery disease and heart failure can lead to certain arrhythmias. So it's just, they do like overlap and interplay. Now, sometimes people have one issue and it's kind of, it can be genetic or something, and it's just that one thing. But a lot of times, especially in our older patients, this led to that, that then led to this, sort of thing.
You know what I find so interesting, except for not really, I guess, because it makes sense. Every doctor we've had on is like, know your family history.
Yeah.
Like, know your numbers. Like, it's so important to be informed because it's like what you said at the beginning of the episode. I don't know how to help you if you don't give me any information, right?
Right. Well, and there's a lot of patients that I see that, and it's sad because like if they had just taken and been more serious about controlling their blood pressure or controlling their diabetes, or their cholesterol for, 10, 15 years before they met me, they wouldn't be in this predicament. Or if they had stopped smoking, they stopped smoking one day and they didn't smoke for 3 months and they picked it back up. If they had never done that before, or if they had never picked it back up, would I have ever met them? You know what I mean? And you can, I tell patients all the time, like, we can't look back. Like, we can't, don't focus on the back, let's focus on the future. And you have this issue, we can deal with it. We do have really incredible medications, that help all of these issues. But you have to come to my office a lot and you have to take medicines, every day. And that's not fun. So that's why it's just so important when you're in your 20s and in your 30s, just to be following, with doctors or PCPs and just getting screened for these things and not ignoring your symptoms. I mean, women, we take care of everybody else. And a lot of times we don't take care of ourselves. And we really need to focus on ourselves first. So that way we're around and we're healthy to take care of the rest of our family.
What do they say? You can't fill with an empty cup.
Yeah.
So.
Yeah, that's right. So
I know we need to wrap up soon. So I have a couple of questions that we want to know. It's kind of old wives' tales we've heard. Like, you can have a glass of red wine every night with dinner, and that's good for your heart. And so dark chocolate and stuff, cherries, I'm sure are probably fine because they're a fruit, But wine is grapes. Grape is a fruit, so is wine good. What are these kind of wives' tales that you've probably heard for decades or whatever?
I mean, I have heard of like one glass of red wine for your heart. I don't know if I don't think it hurts your heart. You know what I mean? I think that obviously if you drink more than that, that actually you can get, you can have cardiomyopathy or you can have cardiac toxicities, I should say, from like too much alcohol. But yeah, I think one glass of wine, everything else being equal is fine. But I will say if we're trying to maintain healthy weights and healthy diets, there's a lot of carbs in wine. So you might want to maybe save that wine for the weekend or something. Yeah.
Well, I think this is a great time to segue into our trending topic. So Brooklyn is going to hand you the bowl.
Okay.
You don't mind reading the question that's in there.
All right. Trending. Getting health advice from TikTok, Instagram, etc. Okay. Good question. So I will say that, and this is kind of true for anything in medicine or even like if you're listening to the news, like you got to know your sources. Okay. So the people that you see a lot of times on TikTok or on Instagram, and they're like, day in a life as a doctor, and they're wearing scrubs. Like, how do I know you're a doctor? Like maybe just bought those scrubs, like, and so I would put very low stock in what they say. I feel like I can listen to their videos and I can be like, oh yeah, you're probably a doctor, or no, you are not. You know what I mean? But the average person doesn't know. So I would not recommend getting any healthcare advice from random people on social media claiming that they are who they are. Now, there are things you can follow on social media, like the American Heart Association or the American College of Cardiology or even Covenant or whatever. And you're actually gonna get information that's been vetted, like it's been proven and clinical trials, and there's, scientific data behind it, and it's actually useful to you. And so that's what I would use as kind of my source if I'm looking for things like online.
Okay. Our day in the lives are real.
Our day in the lives are real. But also, as a former journalist, I appreciate that you said not just healthcare information, but news too.
Yeah. So
thank you. But thank you for that. And also thank you for being here and sharing all of this wonderful information with us. I actually do understand blood pressure now. So
I know.
And cholesterol. Yay.
Get my numbers. I'll know.
I'm going to go home and check my test now. I just did like my average annual yearly thing.
Yeah.
I'm like, oh, now I'm going to go check all my numbers that she told me to check. So thank you for being with us. And thank you guys for watching, listening to this episode. Follow us along on Covenant Health on Instagram, Facebook, Twitter, and we will see you guys next time.
This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician. Many of us love soaking up the sun, but did you know that melanoma, the most dangerous form of skin cancer, is becoming increasingly common? Even if you feel invincible now, early detection and prevention are key to maintaining healthy skin.